Hello, I am Kimberley Threadgill. I am a Senior Wealth Manager at Stansberry Asset Management. I'm also a CFP and a CDFA. I have been holistically advising clients now for about 10 years. Been in the financial industry for about 15 in total. And I want to share a little bit about what we do here at SAM. Stansberry Asset Management is an RIA where we are actively managing strategies. We have our own investment team, and we manage different strategies, each with their own mandate that is designed in order to reach a certain goal for different clients. We don't hold mutual funds. We are big believers in owning productive assets. And we have an amazing investment team that focuses all day, every day on that part of the equation in finance. Now, on top of that, I am part of a team of great wealth managers. And what we do is spend our time working with clients, understanding what their needs are, and deciding with the input of the clients and their holistic financial picture, which are the best strategies or what combination of strategies will work best for them to help them reach their financial goals. So in doing that, I have now, since joining SAM, I currently manage over $200 million in assets under management. And I'm very, very privileged to work with a great team. And as I am based here in New York City. I've come across a question more often than not from clients that are typically in their late 50s, some of them, early 60s, or some of them even mid 60s that have held off. But they're questioning, when should I claim my Social Security benefits? What timing is ideal? And so today our topic is going to be what smart retirees do differently. So I'm hoping that this will be of some help. We're going to get started, just jump right in. So with that, I want to talk about this first slide. This is how you get to the point where you've got you're entitled to these benefits in the first place, right? You have 6.2% of your income up to a certain dollar amount of your taxable income that is paying into Social Security. And what that's doing is that money is going to pay for people who are receiving those benefits now. Oftentimes, and this is something to note, is that the employer is matching that 6.2%, but it's not a small number. And in that number, that maximum taxable income has gone up every year. So if you look, and this is what I'm kind of showing here, is just since 2022. This webinar I'm doing here today we're in 2025. 2022 is not that long ago. In the amount of taxable income that 6.2% can be taken from in 2022 is $147,000. Fast forward to today, and it's up to $176,100. So I don't think that number is going to be going down anytime soon, and I do think this is one component that the government is doing to keep Social Security up and running. And as we go through the rest of this webinar, I think you're going to see there's some other areas and factors as well. So what happens after you have been working and you've worked through your career, you've been paying into that system? And, for some people, they expect to work longer and maybe they don't, just given a job loss or what have you, or maybe needing to retire to take care of a loved one. And so with that change or that circumstance, there can be a question about Social Security, right? And so the first thing I want to touch on is your Social Security benefit schedule. This is a sample of what that would look like. So if you have never seen this, then you're probably pretty young, and because usually Social Security the administration will send this out after a certain age. You'll start getting something, but if you haven't it is something that you can always go and proactively look at. Go to ssa.gov, and you can register online to establish that account and be able to look at what your schedule of benefits are. And it's important to do. I'll tell you, it's not always right. You don't want to assume that it is and wait until you're ready to actually start taking it to look at this. So one thing to look at, it's very transparent. When you go into ssa.gov, register, get your account, you'll see what they're basing your numbers on. And so you want to take a look at what that reported income is, make sure that looks right. But so here we are. Let's say this is right. In this case, this is an example where somebody's full retirement age happens to be 67. So one of the questions I get is, what is a full retirement age and why is it different for everybody? Because it can be. The short answer is it's just there is another way of kind of extending and keeping Social Security alive is pushing back that FRA, the full retirement age. And that's going to be based on your date of birth. So if you were born between 1943 and 1954, your full retirement age, that time when you are entitled to take your full benefits that you've paid into the system to receive, that is going to be 66. Now, if you were born between anywhere from 1955 to 1959, then your full retirement age is pushed back. Each of those years is pushed back further, like 2 months more. So in 1955, it would be your full retirement age would be 66 years and 2 months. And 56, it'd be 66 years and 4 months, and et cetera, et cetera. So for anybody, though, born in 1960 or later, then you're looking at 67. So no surprise, this person has a date of birth in March of 68. So full retirement age, full benefits is $33.06 a month at the age of 67. And so you have a choice here. You can take earlier, but as early as you take it, the earliest you can take is at 62. It's going to be discounted from what you've paid into that system, right? With each earlier year, it's going to be, you're getting a haircut. Now, if you wait beyond that time of your full benefits, then there's a premium that you can receive each year. So that, of course, is something that once you take a look at this, it's saying, well, when is the best time to take it? And of course, that's going to depend on your own special circumstances. So for one, if you're single, or let's say you're divorced, then you've got to take a look at, what are my expenses? What are my income sources? How is my health? If you're in good health, you've got longevity in your family. Maybe, if you've got other sources of income and you can meet your expenses just fine, then maybe you don't need to take at the permanent discount of 62, the least amount that you can receive. Because yes, you'll get a cost of living adjustment, but it's always going to be on that, drastically haircutted amount. And so, you want to think about the bigger picture when you're considering this decision. One thing that I have heard it said from clients that I've met with that didn't really work with an advisor before, they're already taking their Social Security, and they took it really early, and they said, I just took it because I just didn't know if it was going to be around for much longer. And I've never heard it said that if something was to happen to Social Security, it's only going to be for the people who haven't started taking it yet. So it's something to bear in mind, that you really don't want to make decisions based on what hasn't happened. Social Security is still alive, even through lots of changes in government. That's still in place. And as you can see, pushing back that full retirement age is one way of kind of delaying folks from getting their full retirement benefits. Now, another area I want to touch on with single folks is if you are divorced. There's several factors you want to keep in mind. You may have you're entitled to your own benefits. That's great. And in which case you can always look at that. But if you were married to a higher earning spouse and for more, 10 years or more, you were divorced or you've been divorced for at least 2 years and not remarried up to a certain age, then you can look at and consider taking the ex-spouse's benefits, certainly if they're substantially more than what maybe you're entitled to. And so you're not required to wait until that ex-spouse chooses to claim. You can do that at your best timing. And again, this is where working with a financial advisor is really important. This is part of what we do when we are working with clients, especially through those years as you're looking at projections of cash flow, right? Whether it's someone that's just gone through a divorce or various times in their life just leading up to retirement and saying, okay, we have different sources of money sometimes. Some people will have an IRA or 401k, all of that tax deferred money. Anytime we're withdrawing from that, it hasn't been taxed yet, right? So dollar for dollar, it's like adding a salary amount to your taxable income, right? It's like W-2 stuff. It's going to go straight on that 1040. If you've got after tax investments, oftentimes that principal has already been taxed, right? And so it's any withdrawals from that source is going to be only taxed on the gains or on the income, right? And so being aware of those things, and then how does Social Security play into this? Well, it's important to be aware that it's a pretty low bar. But if you're widowed or single and your income is more than $34,000, or you're married filing jointly and your income is more than $44,000 for the year, then your Social Security will 85% of what you receive for the year is going to be taxable. Okay, so when you're considering your different income sources and when to, start to claim, you want to think about, do I want to add more taxable income right now? If you're, again, comes down to all of these different factors: longevity, can you pay your bills, all of that. But, these are all the things that we talk about and consider when we're kind of running through these kinds of plans. So, something to be aware of. Where it gets even more interesting is when you have a couple, and especially when you have a couple where both are eligible to receive their own Social Security benefits. In that case, then it becomes a question of really one of us can take at a different time than the other, right? You both don't have to take at the same time. So when do each of you claim? Now, I'm going to go into some tables here and some comparisons, and I want to kind of set the stage here, but it's not the same numbers as what you're seeing on this slide. We're working with totally different numbers. So as we go ahead, we're going to look at some cash flow projections, because this is going to show you where, if you have read on this topic before, you've probably heard about with a couple, maybe the higher income earner waiting to take it at 70. But I want to show you a sample so you can see how the cash flow projections flow, so you can see some of the merit as an example of possibly doing that if that's the best case and works for you. But again, I would encourage you to work with a financial advisor. There's 6 of us here that can work with you. What we would want is to look at the bigger picture. Obviously, all these components we're talking about, as well as your individual Social Security benefit schedules. All right. So let's get started here. This is a Social Security benefit comparison. In this case, we have both spouses taking retirement benefits at full retirement age. And for this couple, their full retirement age happens to be 67. So the higher income earner is spouse A. And that person's full retirement age benefit, that means at 67, is $3,542 a month. Okay? Now, spouse B has full retirement age benefits of $3,036 a month. So in the table here to the left, what I'm showing here is not the year they start taking it. I've projected this 5 years down the road because I want to show you what happens when one spouse passes. So I needed to go further, later in life to show it. But also too, I think you can see how projections amplify when you use a fairly, I'd say a realistic, we're trying to make it realistic, inflationary assumption rate, which for us, we're using 2.5%. Because again, keep in mind, Social Security has a cost of living adjustment. Is it going to be 2.5% every year? Probably not. Yeah, but we got to go with something. And so this is what we're going to go with. We're going to say 2.5% every year. That's what your Social Security benefit goes up. Sorry. So if you look in this comparison here, so we're starting with year 2040. In the case here, and I'm going to use my mouse to kind of point to it here. In this case, they started 5 years ago, both at the same time, both at full retirement age. Spouse B just has a little bit less than spouse A. Spouse A is a higher income earner. Together, they're making $114,322 a year just in Social Security. We're not counting other income. We're just looking at this. As it projects throughout the years, though, interestingly, we have spouse A now has passed, okay, and passed at the age of 77. So now they happen to be the same age. If you note here, I've got 72/72. That's telling me that spouse A's age is 72. Spouse B's age is 72. Born in the same year. Okay. So in 2046, now we have a surviving spouse. And watch what happens. The surviving spouse continues to have that inflationary component to that person's benefits, but now receives a survivor benefit. And you may wonder, where does that figure come from? Well, what this is, it's what spouse A would have received had spouse A continued to live. Because it's the higher earner, now the surviving spouse is going to receive what was equivalent to that as it projects at the 2.5% going forward. So as you can see, through each year, the surviving spouse is living, and that is certainly adjusted down. Something to be aware of, obviously, when you're thinking about how is that surviving spouse going to be, how is that person going to be comfortable, because we're going to have a significant shift in some of that income when the higher income earner passes on. And so we want to pay attention to that. And of course, being a holistic wealth advisor, you're addressing that and saying, okay, we know we're going to be planning on pulling from here or there. Certainly maybe the mortgage has been paid off by then, and so perhaps the expenses are significantly lower. But the medical expenses are one of those things that we typically don't expect to go lower, and we're going to touch on that too. But let's look at this comparison now, taking a different approach. Now, the higher earning income spouse is waiting and claiming benefits at 70 and not before, whereas the lower income spouse takes early at the age of 62. Now, in that case, you can see a real difference in what their individual benefits are. But what I thought was pretty interesting, I wouldn't know it unless I ran this to see it, is that is that their total Social Security while they're both living is pretty similar to if they both took at 67. It's not really that much more when they both took at 67 versus 70 and 62. But here's where it really does change. This is the notable difference, is that the year that the higher income earner passes, because of waiting until 70, the difference in what the survivor is going to receive in those years alone, without that other spouse, is significantly higher than having taken even at the age of 67 in the prior example. So in this case, the difference being, difference between 71,388 and 88,000 is, I think, certainly notable, because we're talking about, that also projecting from year to year, and at the age of 82, a difference between roughly 79,000 and 97,700. I think that's notable. So, going to the next slide, this is the same couple, okay, and we're using that same example that you just saw. This is exactly what we were just looking at. Higher income earner is taking at the age of 70, and that's delayed out, but the spouse B is taking at 62. But in this case, the spouse B is taking at 67. So waiting until full retirement age, but the higher income earner is still holding out until the age of 70. In that case, what's interesting is that you can see, where the difference really lies in that scenario is how much more they have in total in Social Security income by taking it and timing it that way, comparing the two, between the lower income earner, the one that's taking a little bit less or receiving a little bit less in benefits, but waiting until 67 versus 62 is certainly a difference here in terms of annually 15,000 up to 18,000 every year different in the years they are living, both living. Now, what happens is, again, with the higher income earner taking at 70, the projections show that it makes no difference with respect to that surviving, that's still going to have that benefit of having the higher amount, and that amount being higher than if the higher income earner took at 67. But in this case, the difference in the comparison I wanted to show is for all of these years when they're both living, they're both receiving Social Security, you've got a difference of quite a bit. I mean, 15,000 to 18,000 per year difference. So something to pay attention to. I think it kind of brings to life what we've read about. I know that those articles are out there where people are talking about different timing of things. And so I think actually showing a sample is super helpful. But again, I would say if you're questioning this and you'd like to have a complimentary session on looking at your actual schedules and working through something like this, me or any member of my team we'd be happy to work with you. So going on to the next phase or next conversation or the next facet, if you will, about Social Security, is that oftentimes when I'm working with clients, Medicare often kicks in for most people. They start to claim at 65. There are always exceptions, of course, to that, but let's just go with the mainstream for the purpose of this webinar. And at 65, either people have started taking their Social Security or they have not. But for those that are in those years where they are taking Social Security and they are taking Medicare, right, and they're receiving the Medicare benefits of that, there is something to pay attention to. There's an income effect that will affect your Medicare premium amount. So again, this is something when we talk about where are we going to take income in retirement and the effects of your taxable income, it's paying attention to that, especially as, if you're 65 and older and you're taking or you're paying for Medicare. There is a 2-year look back at your modified adjusted gross income. And the higher that is, the higher your Medicare Part B and Part D will be. So when I am working with clients, we talk about this where I am aware that any bump in their income for various factors, well, whether it's the sale of a home. Now, I don't necessarily mean primary residence. Oftentimes, there is that exclusion of $250,000 in gain that's not taxable for your individual, for your primary, versus $500 for a couple. But if it's an investment property, rental properties, things like that, there could be a bump, right? Especially if you are it's a profitable transaction. Another thing that will affect this is Roth conversions. And so certainly if you are considering doing a Roth conversion and you are taking Medicare or you're close, i.e. taking Medicare next year or in 2 years, then you want to be aware that this can affect your Medicare premium. Now, it would, in that case, for a Roth conversion, it's only going to be affected 2 years later from the year that you did the Roth conversion. But you want to be aware of it. It's not to say it's not the right thing for you to do, but it's something to be aware of. So this is showing the figures for 2025. It's showing you what the monthly surcharges are. Okay, so there's a base Medicare premium amount for Part B. This is in addition to that. So if you are single, then if in 2023, and this again, we're taping here in 2025, so if in 2023 you're single and your income was $106,000 or less, that modified adjusted gross income, then you are not going to have any kind of an IRMA surcharge added to your Medicare premium amount, nor to your Part D amount. It's $212,000 or less if you're married filing jointly. Now, as that goes up, then things change, right? And so these are the different brackets. They change every year. And this is going to tell you what the premium or what the surcharge will be, what we call IRMA, which is essentially the income-related monthly adjustment amount of your Medicare. And so in each bracket, you'll see it can get substantially higher, and it can make your premium per person quite expensive. So you want to be aware of this because, again, what I hear from clients is they'll say, well, we had a big income year, and this happened a couple of years ago, and so my Social Security went down. And really what they're saying is it's likely that their Social Security didn't go down. It tends to adjust up, but so often Medicare is taken out of Social Security, and if there was an IRMA surcharge, that certainly that effect can create a net down or lowering of what you're receiving from Social Security. So something to very, very much be aware of. It's something that we pay attention to here. Especially, for those that have just a great deal of money saved in 401ks and in IRAs and things like that, knowing that when they come of age to have those required minimum distributions, if it's 6 figures or more, it's something to be aware of that's coming. And, brings up some conversations about possibly a Roth conversion if it makes sense. But it's certainly, that conversation is for a whole nother webinar, I should think. But this is something that is always discussed or should always be discussed when covering that topic with a client. So one thing I want to note is there are reasons that you can actually appeal the income-related monthly adjustment amount. that IRMA surcharge can be appealed for a variety of reasons. One is marriage. Another one is divorce. If you are not filing jointly in that year, especially for the spouse that was the lower income earner. So post-divorce, you may not have that surcharge because your income is now going down. So that's always something to be paying attention to. The death of a spouse, also a possible factor. And then there's some certain specialties around loss of income producing property, but not, voluntary sale. Some other factors that come into mind. So I'll leave this slide here up for a minute because it's important to pay attention to be aware of what these factors are. And there is a form that you can go to. Go through SSA.gov and Medicare.org too. Also gives really good information on some of the stuff. But the form that you would need to fill out is going to give you the options of, does this apply to you? And you can appeal that increase in your Medicare premium. Something to note, again, as we're talking about expenses in these later years and when to take Social Security and what are your expenses. I mean, being aware that Medicare is a premium that is, as you can see, can go up and be, it can be quite expensive, and not to mention what Medicare doesn't cover. And these are things that a lot of people will need in their later years, this additional care. And so being aware of that and taking out the necessary coverage to take care of those things is important. But it's something I wanted to bring up because we look at these factors and take those into consideration when we are considering what are your expenses and where are those going to be. Obviously, this is one expense, medical, that tends to, not often does it go down. And another factor too, just real quickly, that I thought was interesting little fact is what the changes with the Medicare Part B premium has been over the course of the years. And this goes back to 2011, where it was $115 and has gone up by $10 since last year, from $175 to $185. So with that, I'm going to conclude just to say that there are a lot of things to consider when you're considering when to claim Social Security, and there's more added when you're a couple. I think that here at SAM, I really work hard with clients to try to grow their wealth, and especially even through those years when you are required to withdraw and use some of these assets that you've built up and save for throughout your life, so that you can have this as supplemental income through the retirement years. And so, and the investing component is a very important part of that, and our team at SAM does a very good job of that as well. And if you'd like to see for yourself, you can go to our website. It's www.stansburyam.com. All of our strategies are actively managed, and they're listed there individually with detailed information on each. So you can take a look and see all of that for yourself, as well as reaching out directly. You can reach out through our main line at 646-854-4370, or scan the QR code to schedule an introductory meeting. And of course, you can always email us as well at info@stansburyam.com. So again, hope to hear from you, but if not, if you still want to learn more about us, here are some options of some ways to do that, and hope that today was helpful. You can also follow us on LinkedIn, on Facebook, and X. Thank you so much for your time. I appreciate it, and look forward to speaking with you again next time. Bye-bye.